Hey there, everyone. Glad to have you with us today as we shift our expert focus today to pharmacy, specifically caring for elderly folks, particularly during COVID-19. We've got a great expert for you today, so we're excited to be joined by Amie Blaszczyk. She joins us today from the Texas Tech University Health Sciences Center School of Pharmacy in Dallas. Glad to have you with us, Dr. Blaszczyk. Thanks for being here.
Thank you so much. It's my pleasure.
So tell us a little bit about your Texas Tech journey, how you got there, and what you do in Dallas at Texas Tech.
Sure. So I arrived straight out of residency back in 2005. I've been doing geriatric pharmacotherapy on the Dallas campus since then. I have an affiliated practice site. I've actually started out at the VA, affiliated practice site at the VA, and then in 2014, I actually transitioned to long-term care. And so my affiliated practice site is with a long-term care company that's based here in Dallas. And so when I take students on their clinicals, we are actually in the nursing home doing medication regimen reviews, patient education, nursing education, all kinds of good stuff. Back in 2011, I actually took over the division head role for the division of geriatrics. And I've been doing that since 2011. And then in 2018, I actually took over the division of pediatrics too. And so despite the fact that the only pediatrics I know about are the 3 that live in my house, I'm also responsible for the faculty that practice within pediatrics for Texas Tech. And it's just, I mean, it's been a great 15 years. So it's a good time.
I think a lot of people may not realize that pharmacy has specialties within the geriatric community and the pediatric community. I think that's really interesting, and Tech has a really robust program in both of those fields.
Absolutely. Actually, all of our students before they graduate have to take a focused experience in geriatric pharmacotherapy and in pediatric pharmacotherapy. And certainly these are, I don't think anyone would argue these are 2 very special populations, and they have their very own unique pharmacotherapeutic needs. So, and we've got, I think it's 14 people across all 4 of our campuses within pediatrics and geriatrics.
That's really fantastic. Now you are in Dallas, and we should note that the School of Pharmacy now offers all 4 years of its Doctor of Pharmacy or Pharm.D program in Dallas. You know, when sort of this COVID thing kind of hit Texas, we heard a lot about Dallas. How's everyone doing out there? What's the vibe in Dallas?
I would say it is, it's kind of, it's kind of both ends of the spectrum. I think there are definitely, with the sort of release of the stay-at-home orders or sort of lightening of the stay-at-home orders, I think there's definitely been sort of an upswing in folks kind of getting out there and maybe behaving as sort of a pre-COVID. And certainly if you've been cooped up for 6 to 8 weeks, haven't had much human interaction other than Zoom, I can completely understand that. But I would say there's a good majority of people, especially our older folks, who have just chosen to continue to shelter in place, using masks when they're out. And so I would say you kind of see a little bit of both when you go out to the grocery stores or that type of thing. I think just from certainly keeping an eye on the COVID statistics here in Dallas County, I think things kind of seem stable for now. I think we're seeing increases in testing, and it's kind of up and down whether or not the cases and the deaths are kind of, they seem to do this, and there's really no rhyme or reason. There's no real upward trend from the looks of it. Unfortunately, the number of deaths are continuing to come from the older population that I'm serving, and certainly those with chronic health conditions. So we've got vulnerable populations that we still need to continue to protect, but I would say things kind of seem stable for now.
Well, let's kind of talk about, serving the older population, and what is the pharmacist's role during COVID, and I guess outside of COVID too, to really, honor and support and treat that population, the geriatric population.
Yeah, I think the biggest things that we are probably, I would say the biggest thing that we're doing differently is really just donning masks and other, personal protective equipment when appropriate. See, that's not normally something that pharmacists are really kind of getting into. one of the things that the state of Texas has actually started to do within nursing homes, because if you look at the statistics, as soon as COVID comes into a nursing home, it is absolutely devastating. And so the state of Texas is actually making sure that they are testing every resident in nursing facilities as well as employees, and that includes the pharmacists. So I would say that one of the new things is that we all get to get COVID tests if we're working in this environment. And certainly this is going to serve as sort of a baseline for where infections are, who might be our silent spreaders, and kind of gives us a starting point for trying to contain this infection in this population. And really it is very devastating. I think one of the things that I've been, as I've been talking to people about geriatrics and COVID and nursing homes, it's really just, it's important for people to understand that while as an outsider, if you walk in, it kind of has this sort of hospital feel. People are in hospital beds, people are eating, on trays in the dining room. But while it may look hospital-like, this is the place where these people live. They have their bedroom, but there's common areas where the virus can be spread. And we've also got a lot of individuals who have dementia, memory care issues, who may not be able to remember the education about social distancing, good hand hygiene. They're wondering, what is this mask? Why do I have to wear it? They're taking it off, avoiding high touch surfaces like handrails. And so it's really, it's about preventing the disease from getting into the nursing home in the first place, to be honest with you. It's very difficult to contain once it's there.
Sure. So what advice do you have for, and what concerns do you have, and what should pharmacists keep in mind if they're caring for an elderly COVID patient, or just caring for a senior citizen out there who doesn't necessarily have COVID, but is under, a high risk of exposure?
Absolutely. One of the things that I always tell my students is that the atypical presentation of a disease process is actually quite typical in the older adult patient population. And so when we first started hearing about COVID, the cough and the fever, that was sort of your typical presentation. And then we started hearing that, there's sort of an atypical presentation with our older adult patient population. And I think for those of us who work in geriatrics, this was really no surprise. But in an older adult patient population, regardless of where they're living, really, what you're looking for are things like mental status changes, things, are they all of a sudden acting very confused? Are they getting lost? Are they asking more questions about, the seemingly, simple to answer questions? Are they more lethargic than normal? Are they saying they're feeling dizzy? Are they falling? I think one of the other things to be mindful of is that fever is typically a little bit different in an older adult. And so even if a temperature seems maybe just a touch elevated, I always recommend that individual get in touch with their doctor about maybe getting tested. And truly a pharmacist, any healthcare professional should be treating older adults with just as much caution as their other patients, the general population, wearing a mask, washing hands frequently, and definitely being mindful of distancing when we can.
I think too that this can be a really scary time for those family members who have loved ones in nursing homes.
Absolutely.
Can't visit. Not only is it scary for those that are in the nursing home, but it can be really terrifying for those outside, right? Any advice there?
Absolutely. I think that, it's natural for us to worry. I think that is, again, like COVID gets into these nursing homes and it can be devastating. And I would say that it is perfectly normal for family members to worry about their loved ones in these nursing homes. One of the things that we have been hearing about, experiencing, is individuals who are saying, what, I'm going to bring him home, or I'm going to take her out of the facility just to protect her. And what I always encourage people to recognize is that they're typically in that facility for a reason, because they need 24/7 care. They need somebody that can watch them, when they wander at night. They need somebody to watch them when they're home during the day, and making sure that they're safe. And so really just making sure that people are thinking through, what exactly does this look like if I bring my loved one into my home again, from a nursing facility. And so, and I think that I do want to make sure that people understand that nursing homes absolutely are not, we are doing everything we possibly can to make sure that we're keeping residents safe. And I think that this baseline COVID testing is sort of step one in that process of making sure that, that we're taking the best care of these individuals, but really encouraging families to do FaceTime and to do all of those things that, you know, because certainly there's the physical health that we worry about, but there's also the mental health issues that we can see with these older individuals who are maybe not seeing their families as often, or they can't go out to church on every Sunday with their family, or, you know, maybe their daughter brought them, you know, chicken every Tuesday night. And they just can't do that anymore. And so I think the mental health is just as important as the physical health, and really recognizing if you do bring your loved one home, that you are capable of caring for them in that environment and in a safe way that is both best for their physical and mental health, but also for the individuals who already live in the home and their physical and mental health too.
I mean, that is such great advice. Really, really great advice, and an interesting topic for sure. Anything else you want to add before we go to our lightning round?
Anything else to add? You know, I do want to, I always like to give a big, huge thank you to the unsung healthcare heroes that are working in long-term care, our CNAs, our med aides, those frontline providers, our nursing staff, all the other long-term care workers that come in and day out to keep, basically just to care for this vulnerable population in both direct and indirect ways. And I think, you know, nursing homes have gotten a bad rap lately. I mean, definitely have had some national attention, and in a way that I think, you know, really focuses a spotlight on some of the issues that we have. But I think that I'd just like to say thank you every single chance I get to those people who are frontline providers in the nursing homes, because they are the ones who are showing up every day to take care of this vulnerable population.
Beautiful souls indeed, for sure. Okay, are you ready, Dr. Blaszczyk?
Let's do it.
The lightning round. Okay, this is the first question is iconic. Okay, crunchy or smooth?
Smooth.
Yes. I must tell you, we've had several in a row of crunchies, and this has been very disheartening for me.
No.
I'm very committed to the smooth. Okay.
Yeah.
Favorite ice cream flavor? If you have a preference on brand, you should definitely share that now too.
Okay, we're going Bluebell chocolate chip mint.
That's very popular among the healthcare community also. If you could name one thing that takes up too much of your time, what is it?
Right now, it is my 3.5-year-old.
Okay. Okay. And what is her name?
His name is Simon.
Simon, what a delight. I love that. I love it.
Delight is one word for it. Yeah.
Okay, if you could turn any activity into an Olympic sport, what would you have a good chance at getting a medal in?
Oh, karaoke.
Really?
Yeah.
What is your go-to karaoke song then?
Oh gosh. Let's see. I mean, Hall & Oates, standard issue Hall & Oates. I mean, anything from their catalog, I will rock it.
Rich Girl is always a crowd pleaser.
Oh my gosh, yes. Fun fact, did you know Rich Girl was written actually about a guy?
No.
But it wouldn't have been as catchy as Rich Guy, especially with two guys singing about it. So.
You are exactly right. What a delightful, I think that's how okay, I usually ask this last one, and I think this is important. Okay, what is the first concert you ever attended?
The first concert. Oh boy, that was, I think it was the Allman Brothers when I was a junior in high school. I think that's what it was.
You are very cool, by the way. That is so awesome. What a nice show to see.
Well, it was, I loved it. And it was on a mountain, and it's like a ski mountain, you know, one of those things where the mountain comes down and then the stage is there. It was glorious.
I am here for that. That is awesome. Well, thanks for talking with us today. You're such a delight to talk to. We appreciate it.
Thank you.
Really, really important.
Thank you. It's been my pleasure.